As an established foundation trust, we've had governors for coming up to 7 years. What's the difference going to be for governors and our local accountability? How will governors use their new responsibilities? How will that work with the new health and wellbeing boards? And for us, how does that work with having 5 local authority areas that we tend to deal with and that range of interaction? So for us, there's some work still to come out in the detail that given the need to make sure this develops benefits for patients is difficult to translate the gap that we've currently got, and we've got to make sure that whatever we do, we can't lose the patient focus in there.
And how do you see your relationship with the local authorities in terms of developing programmes that might prevent people needing to come into hospital?
And that's quite important for us. We actually have a new PFI hospital in Peterborough, and one of our main issues is actually we'd rather people didn't come into a big acute hospital if they don't need to, but when they do need acute care, we need to be there for them. So some of that is working with local authorities and the prevention agenda so people don't need to come in, but also it's about swift discharge, patients getting out, patients being able to be seen in their own homes or in other settings within primary care. And that's very important for us, and therefore the development of pathways, potentially the changes with transforming community services, it's really important for us to understand how they all link together and how we can make sure patients go through that smoothly without being handed off from one provider to another. And that's where the GP commissioners will have a lot of a role in making sure that works very smoothly for them and for their patients.
And how confident are you that GP consortia are going to be up to that task?
I think we're very lucky locally. We have some Pathfinder initiatives in Peterborough. So whilst we could think that it's nothing new, we've had fund holding, I think it will be a very different focus. And I think we've got to work very closely with our GPs, make sure actually that we don't assume we all know what all of our strengths and weaknesses are, but work very closely, build those relationships so that we can develop our services and move on so that they actually match what people want rather than what we think people want.
So how do you see the hospital's function as changing, or the job of a nurse, as you put it?
Yeah, I think the hospital has to, we have to carry on treating patients. I think we'll always have wards, we'll always have A&E departments. I don't think we should, I can't conceive of them not being there, but I think they will be for sicker patients who really need to be in hospital. And the issue for our nursing staff is to make some of the changes real so that they can understand the need for communication to go back to GPs, as soon as patients are discharged. We need to make sure that all of our ward staff, whether they're the doctors, the ward clerks, understand where people are being discharged, that they have all of that information about those range of options for patients so that when people leave us, they're truly informed about the next stages in their care.
So the challenge for you, in a sense, is a new way of working?
I think it will be. I don't think we can expect changes overnight because I think some of these changes will be incremental. But what we have to do is make sure we've got really good building blocks in place so that we can build on something that's stable. And we need to be very mindful of the current changes we're going through, make sure that they don't provide instability for our staff so that we can support them through any of the changes that happen for us and for their colleagues in community settings.
And how satisfied are you that you can meet the competition from other providers, maybe from the independent sector?
I think we've seen that competition hasn't had a devastating effect on the NHS. We've also seen that actually it probably hasn't taken off in some areas. And I think we've got an opportunity locally. We have a fantastic new facility that we can offer patients, and we've got to do far more in terms of promoting our services to patients rather than sometimes the media focusing on things when they go wrong rather than things when they go right. So there's an awful lot of education and information and openness that we need to promote.